Herbert Mwebe is a senior teaching fellow and a senior lecturer in mental health in the Faculty of Health, Social Care, and Education at Middlesex University. Herbert's teaching and research interests focus on best practices relating to improving physical health outcomes in severe mental illness, the safe use of psychopharmacological agents, and mental health promotion. Herbert has also worked in various NHS settings. For those of you not from the UK, that's the National Health Service. He's worked in various NHS settings, including general practice, secondary and primary care services. He is a specialist clinical advisor to the CQC, which is a Care Quality Council, a role in which he supports the CQC to undertake community and health inspections for mental health providers. He is also an editorial board member for the British Journal of Mental Health Nursing and an external examiner at Bournemouth University. Wow, so many powerful things there. He's also a specialist member of the Mental Health Subchamber of His Majesty's Courts and Tribunals Service. Wow, there is a lot of experience there for us tonight, and I'm sure we all have questions, including myself. So, without further ado, Herbert, I'm going to ask you to pick it up, and then we can flow with that. I'll probably allow you to start with any opening statements you may have before I start running my questions.
I just want to obviously say that I am very privileged and happy to be here with everyone tuned in, whether you're in the UK or outside the UK. And I hope we are going to have some serious, obviously, conversations and chat about, I think, a very serious subject and topic that affects everyone, irrespective of color, creed, or background. And I hope there's going to be some interactivity with the audience, and we'll be quite happy to take questions during this session. And thank you, Rexford, for inviting me to join you today. Um,
You're
yeah,
welcome.
thank you.
Great stuff. Thank you. I'm going to start off with this thing we keep hearing every time. People keep saying mental health, mental health, mental health. Now, I'm not sure who our audience is currently or people who would watch this, but when I think of mental health, what comes to mind? I'm originally from West Africa. When I think of mental health, I think of that naked person running around the streets. That's my understanding of somebody who is not well balanced. So to come and you find people who you probably know going up and about in their suits and they're having mental health issues, it raises question, what exactly is this mental health? Are we downplaying it? Are we ignorant about it and stuff like that? So if you can start on that note, what
Yeah,
exactly mental health is all about?
yeah. I mean, one of my, I think, favorite sort of explanations and definitions for mental health itself is by the World Health Organization. I mean, if you do read extensively, there is other definitions where individual scholars have defined mental health, but particularly, I think I cherry picked this particular definition because it really appeals to not only what we take for granted every single day, waking up every morning and being able to sort of plan your day, go to work, take the bus or take the tube, and sometimes those sort of mundane activities in the day is actually sort of reflects our mental health, later on our physical health. So the World Health Organization does define mental health as a state of well-being in which every person, every individual realizes his or her own potential, and that could be in the context of employment, fulfillment around relationships, being able to sort of make social connections in your environment, in your societies, and that when you do that, you can cope with any normal stresses of life, and that working productively in your own environment, in your communities, to contribute, to give back, and also to be able to sort of form those significant social networks in your community enables us to sustain and maintain our mental well-being, and also just really being able to sort of give back to communities where we are, and that we are able to also sort of be part of those communities and draw from those communities in every respect. So for me, that is mental health. Our ability to be able to cope with daily stresses, but also to be able to give back and check in with our loved ones, be able to hold down full-time jobs, and be responsive to some of the things I think in life that may tend to shake us every so often.
If you don't mind, let me just pick up on that point a little bit. I was having a chat with somebody earlier today, and the person said, well, I almost thought that was a very unpleasant statement to make, but I said, well, that's the reality of it. Some people think it's not a disease for certain people in the world. Mental health issues only relate to the Western world. Is that a fact? Is it just for the Western world, or is it something that can affect people anywhere else? And
I
that's
mean,
what.
that's completely, I think, incorrect. I think moving away from sort of what mental health and mental well-being is,
Mhm.
our ability to sort of emphasize, the activity around our lives, holding up full-time jobs, able to sort of form those social connections and to be fulfilled in life, with particularly with mental illness, health, or what is mental illness. And rather quite often, mental illness, is not respecter of creed, race, or background. And so the notion that mental illness is only a Western alien concept, I think that is probably something called out of a Hollywood Hollywood film, because we do know that mental illness itself does affect all of us, whether we're you know ministers or MPs, whether we are film actors, whether
Mm.
we're influencers on social media. Mental illness can affect and be sort of representative of the things that we sometimes we take for granted. But I think you and I agree that it is normal to experience emotions such as anxiety and sadness every so
Mm.
often, and that many of us actually, um, uh, you know, w- w- you've encountered loss, emotions around bereavement, and to a certain degree, when you've had a relationship breakdown, you feel at loss, you feel you're unable to cope because either you've broken up with your boyfriend, or or the marriage has ended. And in fact, most people may find themselves quite unhappy, quite sad, because their favorite football team has lost. And
Uh-huh.
my son is into football, and quite often when Arsenal loses, he's always in a kind of very foul mood, because he's quite sad. His team has lost. But again, we need to be able to differentiate, everyday normal sort of sadness and kind of unhappiness, to sort of pathological presentations, where perpetually, if somebody has got a mental illness, particularly if they're unhappy, and that unhappiness is every day, most days of the week, and that it's affecting their ability to either leave their home, cook for themselves, go to do some shopping, or even going to work. We tend to see that that then becomes more a pathological presentation, as opposed to sort of normal everyday sadness, which is quite normal. For most of us, we do tend to have those emotions every other day, every single day, but does not necessarily mean that we are mentally unwell. But to define mental illness is when these symptoms of sadness and unhappiness, um, to a degree, do affect our ability to live a normal life. And in most cases, when those symptoms persist, they can affect our ability to actually maintain and even formulate normal relationships. And
Mhm.
those things can actually further affect our ability to feel part of our societies. We may withdraw from society. We may withdraw. We may not go. We may not feel like we want to go to work because of the stresses around those psychosocial stresses. And so mental illness can evolve and develop, from sort of symptomatic presentations that
Mm.
sometimes we may take
Okay.
for granted.
Right. So what can we say mental health is not? Mental illness is not.
So again, that's what I've tried to explain. Sort of normal everyday, unhappiness of
Mhm.
maybe you've lost, you've run to the tube station and your train hasn't arrived on time and you're quite unhappy about it, and you're quite, you want to write to transport for London about how the trains should be running on time. It might cause you a bit of anxiety because you probably are going to get to work late. And those everyday normal emotions, our bodies are created to actually respond to some of these stresses in life, but also to be able to manage those stresses. That you can shake it off. You can shake it off. You can say, well, you know what, the train hasn't come. I can wait for another train. So what I'm trying to explain is that those normal everyday reactions to stresses in life, they're part of who we are. In fact, they reflect, our normality. They reflect our humanity. But mental illness then becomes pathological, and pathological, I mean, it becomes an illness of symptoms when some of these concerns then they become of a nature and a degree that they affect the individual every single day. That if the person feels, yesterday I missed the train, last week I missed the train, probably there's something wrong with me, I should be on time. And that negative reaction, they're not kind to themselves. They aim to be, but they internalize most of the external, psychosocial stresses, and they feel that they are to blame. So it's gone from a place of normal everyday stresses, and they are becoming pathological. They are becoming, sort of interfering with your mind, interfering with your thought and your thinking as well. And quite often, you may not necessarily want to go back to work. You may say, "Well, I'm waking up in the morning. I'm going to stay home. Never going to go to work because and sometimes those emotions they creep in, and before you know it, a you know you don't want to go into work. You probably are cut off from your immediate family. They may be calling you and you don't want to engage. And in fact, when you leave the house, you may have this sense of apprehension and you're fearing. And so that's where we tend to see that mental health issues or mental health illness sometimes can then start to become more of a problem because it's affecting the individual's ability to live a normal life. In which case, most people will probably even speak to their family about how they feel or seek support from clinical services. Obviously, in the UK, they may go to their GP feeling either sad about their lives, they are not coping, they may have lost interest in the things that they once obviously enjoyed doing, but because of significant life events, those can generally affect and determine our mental health and well-being.
Mm. Awesome. Just for our audience to know, maybe when they hear the sound behind you, nobody to get jittery. It's just some fireworks in the background there. um, yeah. How common is mental illness? I mean, in terms of like, if you're looking at demographic, stick to the UK for now. Are we saying it's more of a problem for particular categories of people, or is it more for particular races or ethnic communities, or uh, it's case by case basis?
I think there is a different, obviously, literature on that, but we know particularly in the UK. And I think this is also probably maybe shared, in the developed countries as well. We tend to see sort of particularly people from the lower socioeconomic sort of background, and again, people, particularly people from African and Afro-Caribbean background, Asians, we tend to see a lot more mental illness in these subpopulations. But even, I mean, minus obviously the prevalence of mental illness per self per obviously particular subpopulations, we do know that one in four people will experience a mental health problem of some kind here in England, and obviously we've just lived through the pandemic situation where now there is actually an increase in people presenting with mental health problems in primary care. And rather quite often, again, over the past 5 years, we have seen that one in six people do report experiencing that particularly common mental health problems in any given week in the UK. And these are things like grief and loss, sometimes moderate to severe depression, post-traumatic stress disorders, and even reactions to trauma, particularly thinking about the pandemic situation where people obviously were isolated, and the fears around living within the pandemic situation of not going out, not doing the things that people once enjoyed doing, in themselves can increase and induce what we call sort of mass traumas in communities. And it's surprising, therefore, that since after obviously the economy has opened up, particularly in primary care, there is an increase, obviously, report of people presenting with a lot more, traumatic sort of reactions and anxiety and depression because of COVID-19. We also tend to see anxiety disorders as well as health anxiety across the population, as well as conditions called obsessive compulsive disorder. But we also know that, particularly before the pandemic, so one in five adults, so that's about 20%, obviously
Population. Mm.
experienced depression in round about 6 months into the pandemic situation, and obviously that has gone on to be reported in primary care to where these individuals obviously they need more input and access to services, and obviously the demand on services is has gone up because of the effects of the pandemic situation on individuals, but also with children as well. We know that one in eight children aged between 5 and 16 do have a mental health problem. And this, again, thinking about the pandemic situation, most of the young people, they were obviously did not go into school environments, and that kind of sort of exclusion from places, areas where they would have sort of formulated social connections with their peers, undoubtedly does increase, you know, mental health issues within our children. And in fact, many schools did report that when many children returned back to school, they did see quite a lot of anxiety and eating disorders and just fear and worry expressed in primary schools by young people. So I mean, a lot of this really is cross populations, but we know particularly in England, people at the lower end of the pecking order, so the lower socioeconomic background. Again, this could be people from obviously African and Afro-Caribbean backgrounds, immigrants, recent immigration. Now we're living through obviously quite a lot of media stories about immigrants flocking in via Calais and France and all of that. We do know that a lot of immigration is actually associated with an increased risk of mental illness, because people are leaving their communities, their normalized communities where they live, to travel many miles to new environments. And I think adapting and being able to be in these communities sometimes can increase the risk of mental illness.
Right. Okay. It's interesting you talk about the immigration bit. Probably I would never have thought so much about people having those. I would have thought euphorically they were coming into a better environment. But you're right that they have unsure. They're not sure about the expectations being met and things like that wherever they are going, whether things would work out for them or not.
Yeah.
Right. Thank you so much on that. So, would it be wrong for somebody to say, look, if I'm affluent, I wouldn't really need to worry about things like mental health, or uh, there could be other stressful scenarios that could also arise for people like that?
I think what we need to unpick here really, Rexford, is what drivers, what factors can expose us to mental illness, and rather quite often, again, the issue of social class sometimes comes into play, not only in the area of health, but also in education as well, because we do know that if you have enough money in your pocket, in fact, if you have extra pounds in your pocket, you can afford private, medicine, you can afford private insurance, and that actually can, in a way, reduce some risks that we tend to see in people with relatively lower income, you know.
Mm,
Uh, but the etiological, sort of factors that cause mental illness are quite spread across our communities, across populations, in fact across the geographical sort of placements. But we do know that mental illness, um, uh, there may be some psychosocial drivers to what causes mental illness. And but before I talk about the psychosocial drivers, I want to focus just briefly on sort of more the organic causes, or the changes within the brain that we have known, and really have been really the focus of neuroscience and also psychopharmacology for many years, that may help us to understand why people may develop a mental illness, for example, depression or anxiety. And we do know that within the brain itself, there are particular pathways, neurochemical pathways that enable us to, participate in normal daily functioning. For example, laughing, emotionalizing events, feeling happy, even thinking clearly when you're sitting an exam and you've read things and you want to concentrate and you want to remember those things. There are particular neurochemical pathways within the brain, that enable us to be able to do many of that. Now, these neurochemical pathways or neurotransmitters, they actually do play a fundamental role in enabling us to do many other functions, not just around cognitive obviously functioning, but also in terms of other body physiology. Now, in mental illness, particularly, we know that there are chemicals, for example, dopamine and serotonin, which actually play a fundamental role to regulate our emotions, how we think, how we relate with others. But so the hardwire of the brain aspect of it really tells us that in people with mental illness, particularly those who are diagnosed with a mental illness, for example, depression, anxiety, and schizophrenia, which is the more severe form of mental illness, that these neurochemicals in the brain are affected in terms of how they are being produced in the brain, and also how the brain uses them. So that's one area I think to explore really. Although recently there's been quite a lot of inconclusive research around whether these neurochemicals, whether they indeed um, uh, uh, really reflect the etiology of mental illness. Now, the other causes as well, so genetic vulnerabilities as well. We do know that sometimes, in fact, often we are born in families where we may be we may inherit genes from our grandfathers, parents, and those genes may be
sure.
faulty. And in fact, transmission sometimes can affect mental illness, but malnutrition as well, early child sex abuse, and emotional abuse and physical abuse. All of these issues are often really form part of research and have been
Mhm.
investigated that may reflect the cause of mental illness. Substance misuse. So we often take for granted young people, even adults, abusing things like crack cocaine and heroin and stimulants, those psychoactive substances sometimes can actually increase the risk of mental illness across the population. Even small things that people take for granted, losing a job. If you lose a job one too many times, and you lack the social support network, for you to be able to focus and perhaps maybe be supported to find another job. All of those issues sometimes can mature and affect our ability, to really get back into sort of the normal rhythm of life, therefore increasing our happiness about many various things.
Wow.
Yeah.
Seems like a lot to be able to take in terms of all the different causes and issues
Yeah.
that are concerning that. But let's come to another area, because for maybe somebody listening in today or watching would be thinking, okay, I've heard about the causes and all that, but how does this help me? So, what kind of mental health first aid is available? How do you undertake that kind of a thing? I mean, from the perspective of somebody, whether self medication or dealing with themselves, and then the second scenario is maybe how you support somebody with that scenario.
Yeah, I mean that's a very important observation, Rexford. Um, the interesting thing is that when we think about our physical health, we've got all of these tools and frameworks, and that can actually help us. That actually help us to be able to identify when somebody, is physically compromised, when they have physical symptoms. For example, if you suspect somebody is having a heart attack or they've passed out, you're going to run to them to check for the signs, for any signs of life. Are they breathing? Do they have any circulation? And so that's first aid. Most of us are trained to offer and deliver first aid in our workplace, or in our in our homes. So there's an ABC plan when you undertake first aid. So airways, breathing. You want to give CPR to enable that person to be able to stand a fighting chance. And it is very memorable because if you remember ABC, you can just about use it wherever you are. And the same notion applies, I think, to mental health, and particularly mental health first aid, because we don't often talk about mental health first aid in our schools, in our communities. So, for example, if you see somebody on the train and they're not seeming, they're not themselves, are they crying? How do you actually approach them to start conversations about what it is that might be bothering them? And so the concept of mental health first aid actually began or started from that understanding that if we can think about physical health with a clear, structured sort of assessment plan to alert individuals to anybody who may be at risk of maybe a myocardial infarction or a stroke, we need to be able to do the same thing for mental health. And so the abbreviation or the acronym that is often used to allow us to understand this, the support we need to be able to give to service to people, if we suspect there is concerns around their mental health, is called ALGI. So ALGI basically stands for A, you're going to want to approach the person and assess for any risk of harm, or even if they're reporting any risk of harm to themselves or harm to others. And then L stands for you're going to want to really just take your time and listen, being non judgmental. And this is important because quite often, because of the degree and the stigma surrounding mental health, mental illness itself, many people do not want to talk openly about the struggles that they may be having with their mental ill health, and sometimes that can delay treatment as well as access to services. So, in terms of approaching people that you may suspect are suffering or could be reporting symptoms of mental ill health, you really want to just come from a place of, you want to help, you're there, you're not going to judge them, and that you're there to listen to their story in the hope that you can work with them to be able to identify how you can support them. Now, the other sort of letter in the acronym stands for GI, which basically says you want to give support and information. Obviously, if you don't know, you're going to be clear and be honest about it. But as I suppose you can always, most people here know probably how to call 999. If you suspect that the person is immediate danger, you can call 999. Or in primary care, obviously, primary care, where is the first point of contact for us in England, you're going to want to advise the person to go to see their GP and encourage appropriate professional support, help, and so on and so forth. Because all of these things can actually allow the individual to be able to reflect about their symptoms, and that there's actually support beyond the symptoms that they may be reporting to you. And in fact, your role as a mental health first aider is very similar to the role of a physical first aider. You're not there to judge, you're there to ensure the safety of the individual. And you're not expected to diagnose or treat them of any issues. You're just there to guide them, to support them, to ensure that, when you leave them, that, you can actually, ensure that they're safe, either to return to their own home, or they're safe and you've got the emergency services there to support them and to provide any other professional help. In fact, when you do all of this, you can actually save lives. You can save lives as opposed to walking away.
Right. Okay. So algae, that's what we call it. Okay. I'll remember that. I was trying to write when you were speaking there, but I'm sure I'll be able to get some more details on that later. Um, what when you talk about approach and looking for signs and things
Yeah,
like that, do you want to say a little bit more about that area? Because obviously sometimes you would find cases of somebody stress. Do you stop somebody from jumping
yeah,
the train, or you look at somebody on I mean, there was a case where somebody was just released from maybe a place. I'm not sure if they were being sectioned, but they get on a train and they stab somebody else.
yeah,
How do
yeah.
you deal with scenarios like that? Are you going to be witch hunting when you get in places looking at people who look odd and things like that?
Not quite. I think it's one of those old sayings about who is your neighbor. Is your
Mm.
neighbor the person that has lives in the same street like you? Is your neighbor is he the person that sitting next to you on the tube? And I think we live in a society where most of us, tend to sort of disregard people around us, unless they are either within the people are within our immediate family or social support sort of connections or networks. And that I submit to you that our neighbor is anybody, really, whether they are strangers to you, anybody that you see who might be in distress, and that we owe it to ourselves as human beings, but also for the sake of humanity, for us to be able to reach out and start conversations. Now, the ALGAE acronym, particularly the approach part of it, obviously, if you spot signs of mental health issues or mental health problems, the best thing to do really is to approach the person directly. Sometimes this can be quite difficult, particularly if you don't know the person, but I think the one thing that you have to bear in mind is that you're actually trying to do good. You're trying to reach out, and in your mind, you're trying to reach out and understand what it is that the other person is going through. And sometimes you may have to think about things like, oh, is it the right time and place? Considering sometimes the most comfortable environment for you to raise, for them to raise their concerns, is a public place more appropriate than a private space. So some of those questions, they sometimes they may go through your mind, but you should be guided by whatever the person prefers. For example, you may want to just offer them a private space if, for example, you can find a private space. Yeah, if you can, take them to a park, you can give them those options for them to be able to do that. But also be mindful of personal space as well, because particularly if the individual is having anxiety, or they're frightened, you don't really want to be in their face, because again, different people may react differently. And particularly in terms of opening up, do respect people's privacy, unless of course you think there is a risk of self-harm and also harm to others. And just allow yourself to start a free flowing conversation without judgment, and being able to sort of give them options, give them prompts. For example, you may say that I have noticed that you have been working late, or I have noticed that you're tearful. Ca- can I ask, why? If do you mind, if we can talk about it, just give them the option, for them to be able to open up, and really to show you that yes, there is something that really we can both work on.
Can I tell our audience, if you've got any questions, please drop it in the chat as well for us. I know some of you are commenting there, but if you've got any questions, something that relates to you or somebody else, you can ask the questions, and I know Herbert will be very happy to answer the specific questions for you. But I'm going to throw a different question, Herbert, this time. It's got to do with people of faith.
Yeah.
And the belief in either destiny, or belief that prayer would work, and all that. Should they be seeking, despite the faith, should they be seeking help when they have situations, and should it be encouraged that they seek professional help as well?
I think there is a big overlap
Mhm.
between mental health and spiritual well-being.
Mhm.
And in fact, there is actually a report by, I don't remember the name of the organization really, that looks into sort of healthcare workers, particularly in the NHS, being informed and being spiritually aware, and to delivering sort of spiritually informed well-being activities within, not only sort of mental health services, but also physical health services. And the important part of this is that, a greater proportion of the population in the UK, but also away from the UK, for example, in Africa and Asia, people do have different beliefs, different, belief systems and concepts, what it is for them in regards to health and well-being. How do I recover if I believe I've got cancer? How do I recover if I believe I've got headache? In most cases, some people do pray to Allah. In most cases, some people do pray to Buddha, or the atheist may choose not to pray to anything. If you obviously incline that way. But I suppose what I'm trying to explain here is that individuals have different interpretations of where they draw their recovery, or they draw their improvement per se. And this is not any different to both health and spirituality, really, because we tend to see quite a lot of spiritual care, spiritual healing in reference to mental health. And that is perfectly fine, because this is often influenced by people's cultural backgrounds, traditional beliefs, how you're brought up in families, and you believe to overcome a particular situation. But one of the things I think to recognize here, really, that rather quite often, and we tend to see this in communities and cultures which are heavily sort of maybe oriented to sort of Christianity, and maybe even the Muslim faith, that rather quite often, when there is a mental illness, when they suspect there is a mental illness, even sometimes it may be that, yes, they probably need to go to the imam, to the priest, to have those prayers, and that's perfectly fine. That's perfectly fine. But I think what I need to be clear about here, really, that in most cases, most of our loved ones who may present with symptoms of mental illness, And these symptoms may be things like, sometimes they may feel like they're hopeless, they're excessive sadness, and they're withdrawing from their family members, they're withdrawing from their friends, and in extreme cases, they may actually report that they have feelings and emotions, and that those emotions are actually are about them not wanting to be around, and in extreme cases, they may feel suicidal, or they may actually hear things or see things that are not necessarily there, that other people are not able to see. Yes, by all means, if inclined in any religious affiliation, yes, you can very much, consider, being able to sort of, draw on your religious sort of background or your spirituality, and that's perfectly fine. But rather quite often also we do tend to see that your engagement with clinical services, so again I'm talking about clinical medical services, alongside spiritual interventions, can actually improve the outcomes, particularly mental health outcomes in service users. And in my experience, rather quite often, particularly people from the African communities, who are often sometimes, for one reason or another, yes, they completely believe that yes, God is going to heal them. And I'm a Christian myself. I believe in total healing, but also being a scientist, to believe that God can heal through medicines. God can heal through my doctor, my GP, even though the GP is not a Christian. So I suppose what I'm trying to say is that we need to be able to balance our cultural traditional beliefs with the benefits of what modern science has given us, because the benefits of modern science actually come from, I believe, again, I apologize if you're on here and you're a Muslim or you're a Hindu, but I can only attest to God, who I believe in, that even the interventions, the intervention driving science nowadays, if you think about even the pandemic situations, most of the interventions driving the science behind the pandemic situation, particularly the interventions around the COVID-19 vaccinations, they are probably driven by the miracles and the wonders of the Almighty God. So if you have a loved one or a family member who you suspect is probably, you suspect may be suffering from a mental illness, yes, you can remain focused and pray for them, but there is no harm in seeking medical support, via the general practitioner, or via, A&E, because that service is there for you to access. And we do know that people that actually seek support early enough, they have better outcomes, they recover better, and they can obviously return back often to normal functioning. So that is really my view on spirituality and
Okay.
well-being.
Thank you. We've got a question here from Ruth. I'm just going to put it up on the screen for you
Yeah.
there. It says, how can we effectively deal with the stigma of mental health in the Black community? Too many people and families suffering in silence and not seeking professional help.
Ruth, that's a very good question. And 2 weeks ago, when I was at the Muslim community in Islam, I had a lot of conversations with the community there around this particular actually question. And I suppose one of the things to explore here really, again going back to the acronym, the ALGI acronym, approaching people, being able to engage people. You're going to want to be able to explore the reasons. And as an academic, I have got a very inquisitive mind. I am always, going beyond what I know to know more, and I never want to rest until I actually satisfy my what I call unknowns. And that's important because many times in our communities, and not only sort of the Black communities, but also I have seen, stigma around mental illness in even known, Black communities, but we want to be able to go beyond that and explore, engage, ask questions, reasons, why, people have these beliefs about, coming forward or talking, being open about particular struggles that they may be experiencing. There may be reasons. There may be reasons, and it's not for us to judge, but it's for us to respect those reasons. But
Mm,
what we can do while we respect those reasons is to be, the mouthpiece for reason, because quite often the stigma around mental illness is often you know built on unfounded, sometimes irrational perceptions about what the healthcare system is and it is not. And um, and, and, and again, the one thing to say here, if you go to our inpatient services here, particularly within mental health settings in London itself, they are full of particularly people from black and ethnic minorities. It may be that, well, there's a degree of racism that maybe is often reported. Particularly, again, we tend to see that more people from an ethnic background are increasingly more prone to be sectioned under the Mental Health Act. But also, there is a notion that um, is it likely that many of us, we do not present early when we should be presenting early, because we are seeking alternative interventions, and that when we do present to services, sometimes it's a little too late, and that we end up obviously in services when we have really serious disease. So having conversations within our communities, I think, I believe, is probably the antidote to healing and trying to anti stigmatize the concerns and the perceptions that people may have about what mental illness is or is not. And particularly, I tend to find this in recent immigrants, or not necessarily recent immigrants, but also immigration where, you have your, first, second generations. They come from maybe Africa, East Africa, West Africa, and, where they still have those intonations about, well, that person is mad, is a lunatic, and all of that. And having us to be able to sort of harmonize the language around mental illness is important in our communities. And I tell you why this is important, because mental health is just as important as physical health. In fact, it should be everyone's goal. Healthcare professionals, public employers, the third sector, the government, it should be everyone's responsibility to use language that is actually welcoming and positive, as opposed to using language that may make people feel, excluded from seeking help. And
mm,
sometimes the serious implications for this, as I said often, is that people may feel that they do not want to talk about how they feel to their parents, if their parents, are heard often talking about people with mental illness as being mad, crazy, lunatics, or lazy, or unhinged. In fact, when I started working in mental health services many years ago, I remember I had a chap from Ireland. He'd been working for many, many years, but for some reason, he was still quite, caught up in the sort of unhealthy language, referring to patients as lazy, unhinged, insane, psychotic, attention seeker, schizophrenic, and that
mm,
this type of language, if we do hear it within our communities, referencing people with mental illness, if you pick up on this language, you're probably going to also believe that, yes, actually, if you got a mental illness, you're lazy. Therefore, why should you really go? Why should I support you? Because you're just lazy, and that this language does actually more harm to obviously reinforce some of the concerns that people may have within our communities. So you may actually want to use more positive language. For
mm,
example, you may say people living with a mental illness, because if you say, oh, the person is schizophrenic, you may say, well, that may generally mean that the person has the problem,
mm,
and we do know that often that can sometimes make people unwilling to actually talk about their issues with you, because they've received that label from you, and that they may not be unwilling to talk about those issues. So the language is important, Rexford, but also being able to have those conversations constantly in our communities, and we should not be shying away from those conversations. Just like if you break a bone, you probably find that people come to you and say, "Oh, I'm very sorry. Is it your tibia which is broken? I'm really sorry." But rather quite often, people shy away from actually conversations around, "Oh, you're depressed." They don't want to talk about it. We should be reaching out and empathizing with
Mm.
people, but also making sure that yes, we are there for them should they need our support.
Yeah. Thank you so much on that. I was just having about three or four questions in my head, but I know we're running out of time now. What I am going to tell my our audience is to, if you've got any questions that you would like answered, I mean, I have a couple more, but time won't permit us to get into. Please send in the question or put them in the chat as well, so they can be picked up. And then when Herbert comes in 2 weeks' time, remember this is on the first and the third Saturday of the month, he would be able to address some of them. One of the things I wanted to ask, which maybe we can take forward to the next one, is what if somebody does not want help? What do you do? And then also, maybe somebody living with a relative who has these issues, and maybe the people can get aggressive sometimes and all that. What do you do? And maybe you're a mom and you don't want your child section and things like that. But meanwhile, the child is kind of, I don't want to use the word nuisance. It's a bit of a problem at home. So maybe we could look into some of these for the next bit. I also wanted to let our audience know about, because you've been talking about medications and all that. So I thought I would just drop in something for our audience to also know that you have a book,
Yeah,
um, and I'll be encouraging those in the healthcare profession, particular mental health, to join us on the 19th of November when we have the second session. It wouldn't be an academic exercise, but Herbert will be looking at different types of treatments and that can be used, and not maybe the same things that sometimes people will say it makes me suicidal when I do take this and all that stuff. So we will be looking at that aspect as well, as well as how you support people who have issues like that. Um, so I just thought we would mention that. So Herbert, maybe you'll pick up on that for our next session and then talk about some of the medications that are available to.
yeah, yeah,
Yes.
yeah, yeah.
Right. I just wanted to throw my final thoughts in, and this it's been a very lively discussion. Apologies to our audience for the camera failed me there. I don't think it has a mental issue of its own, but it can get sorted out. So that's why you see me sideways on there, but it will be fixed up for the next session. But Herbert, thank you so much for the things that you have discussed. I know there's a lot more there to be talked about, but I believe that those who have heard have received something that's going to be helpful or useful to them going forward, either for themselves or for family members, some work colleague. Um, I'm even thinking about also mental health issues at work. So maybe we could pick up some of that too when we come for the next session.
Yeah.
On
Can I
that note, yeah.
can
So
I can I
yes, go ahead.
just if you just a few points just to leave with the audience, um, sort of on a personal note, kind of a personal level. I think you can help yourself really to keep yourself in good mental health, and these are things I kind of apply to my life every day, and I we all talk about them with with my wife. It's talking about your feelings. Quite often, sometimes I struggle as a man, and sometimes we do struggle generally as men to talk about our feelings, really. But this is something I have actually learned to do in order to feel relieved. And rather, quite often when I'm not relieved, I realize I haven't really talked about my feelings. If you need to cry, do cry. I love a
Mhm.
good cry every now and then. Actually crying is really, really, really therapeutically beneficial. Keeping active. I don't know how many of us, we live really busy lives. Get a few, hours in the week. Keep active. Go for a run. Eating well and drinking sensibly. Keeping in touch with friends and family and loved ones. We spend an awful lot of time on phone, on social media, on digital platforms, and we kind of disconnect from the realities of life, the people that actually really care. So do really keep in touch with friends, asking for help when you need it. I used to struggle with that quite a lot, but really, 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 when you feel that there is a need for you to speak up, ask for help. That is important. Taking a break every now and then. Again, talking about busy jobs, Rexford, I'm sure you probably agree with me. If you have a busy job sometimes in
Right.
London, you just non-stop. Take a
Mhm.
break. Take a break. Do something you are good at. Enjoy. Sometimes, obviously, living through the pandemic situation, most of us have probably lost interest in things that we once used to enjoy to do before the pandemic situation. Pick those habits up, pick them up, because they can actually help to distress you and address any stress hormones that may be building and increasing over time without your knowledge. And accepting who you are. I am 5'6" tall. I would have wanted to be 7 foot, but I realized after my GCSEs, I'm not going to be any taller than that. Jokes aside, that is important. You need to be happy with who you are, because only you can find that happiness. You can never find that happiness from Facebook, from how many likes you get on Facebook and Twitter, but only you can find the positivities about yourself. And caring for others, it does not take you you do not have to lose £1 million to just say hello to your neighbor, to say hello to the person on the tube. Those small, ounces of kindness and happiness can actually extend to you, and they may actually improve and enhance your own well-being. So those are points I just wanted to leave with the audience.
Awesome. I will call them the 101s. Those were very good. I've taken some notes for myself. Thank you for the cue about not overworking yourself. I'll take that on board as a rebuke for myself. So I give myself a break as well. But thank you so much, Herbert, for this. And you almost opened a can of worms when you touched on social media, because that's also something I have found in the particular age groups. Surprising, people in their 30s are getting depressed because social media is disorienting them. So we could pick up on some of that as well in the session on the 19th of November. To our audience, thank you so much for joining us today. We believe you've been impacted by what Herbert has explained to us, and there'll be lots more time to answer questions in the next session as we delve down to supporting treatment and other related items. Thank you
Yeah.
so much, everyone, for joining us on this live stream today. Thank you, Herbert, as well.
Thank you.
Thank you.
That's all right.
Thank you.
Thank you, Rex, for
Bye-bye.
having me.
Thank
All right.
you. Thank you, everyone. Thank you.